Hello, hello, hello. I hope you're doing well today. What we're going to be talking about is how to know if you would make a good health content writer, particularly if you are a pharmacist or a healthcare professional who's been hanging around my account, learning more about different types of medical and health writing, specifically learning more about health content writing. And you've kind of been thinking about whether or not this is a path that you would want to pursue. I want to help you answer a question that you might be thinking, which is, how do I know if I specifically am cut out for this and would make a good health content writer? So there are kind of two buckets that we can think of this question in terms of. First is skills, and then second is characteristics, like attributes that make for a good healthcare writer. In regards to skills, if you did not catch yesterday's video, which was about 5 steps to take if you want to be a health content writer, that video really covers the majority of the skills that you need to be a healthcare provider entering this space of health content writing. So I would encourage you to go back to that video and watch it all the way through so that you can learn about the majority of skills that you're going to need. One set of skills that we did not talk about in that video, though, that I will mention now, um, is a set of foundational writing skills. And when I talk about foundational writing skills, I really mean the basics of writing, right? Like spelling, grammar, how to make sure sentences and paragraphs and a piece flows together. That is going to be, if you are starting from a foundation of strong, just regular writing skills, then it's going to be easier for you to learn the nuances that are necessary in order for you to be strong at health content writing, right? Because there is a specific set of skills that you need in order to be able to create content that is educational and informative and also supports a company's marketing goals, which is essentially what health content writing is. There's going to be a certain skill set that you need to learn for that. And it's going to be easier for you to learn that skill set if you already have the foundations of writing, the spelling, grammar, word flow, organization of writing a piece, if you already have those skills down. So in addition to the skills that we talked about in yesterday's video, you will also want to have foundational writing skills. And if you feel like you need to brush up on those, look into resources that can help you do that. So LinkedIn Learning, if you have LinkedIn Premium, then you have access to LinkedIn Learning. They have a lot of great foundational writing programs there. You can also check out platforms like Coursera, other online education platforms that'll have basic writing courses or programs or intro to writing, things that can help you brush up on those skills. So that takes care of the skills bucket. Let's move on to characteristics and attributes, because those are the things that I think are most important to have a grasp on before you enter into the health content writing atmosphere. So I'd say the first characteristic that will be really important is an eagerness to learn. I think that for a lot of healthcare providers, this is a given. A lot of us are learners. We enjoy learning new things. We enjoy applying the information that we learn, retaining that information, being able to talk about it intelligently. The thing here, though, is that um, the aspects of health content writing that you will need to learn in order to be a strong health content writer are going to be much different than the topics that you're used to learning about, right? We're used to learning about therapeutic areas, new medications, new therapies, things that are related to like the science and the medicine. We're used to learning continuously about those things. But when it comes to learning about content writing, content marketing, digital marketing, that's like a whole different sector of information that maybe you are not used to getting up to speed in or learning about. So really having an eagerness to learn outside of the topics that you might be used to learning about and practicing. The second characteristic I would say is an ability to think strategically. So once you start to learn more about content writing, content marketing, digital marketing, you will realize that all of this, or a lot of the content that you see out in the world, is there for a reason and has been produced in a strategic way. And so when you decide that you want to be a health content writer, um, yes, you are educating people on different medical and health related topics, but you're doing it strategically. You're thinking about who is the audience that I am speaking to, like in detail, not just I'm speaking to women, but like really diving in about what type of woman, what type of person, what type of healthcare provider you're speaking to, where do they work, how do they think, what kinds of interests and hobbies do they have. Like you're really getting granular about who you're speaking to. You're being very strategic about the message of your writing. You're being very strategic about what you want that person to do after they finish consuming your content, right? So let's say you're writing a piece about medication safety, and the specific topic is how to keep medication safely in your home when you have kids or pets. And so you want to say, okay, after I provide this information through this blog post, what is the call to action? What do I want the person who read this to go and do or act upon once they finish reading this information, right? So there is a lot of strategy that goes into health content writing. And so the ability to think strategically in terms of communications is going to be really important. A third attribute that will be helpful for you is a bit of humility. And I say humility because you have to be open to critique and criticism. I'm not saying that you need to subject yourself to any toxic environments or toxic people, but you have to be receptive to and welcoming of critique and criticism, because unless you have prior experience as a health content writer, chances are you're going to start out like most inexperienced people start most things, with a lot of room for improvement, right? It might not be great the first couple of times you're writing. Um, and so you have to be mentally at a point where you are open to criticism, because you know that that critique is going to help you improve over time. It's really great when you're a health content writer and you are working with an editor who's really good at providing that feedback and that critique. When I wrote for GoodRx a few years back, my that writer editor relationship was one of the best that I've had, because the feedback that was provided was meaningful, it was specific, it was and it helped improve my future content. It was collaborative, it was informative, it was exactly what I needed in order to understand what not necessarily what I did wrong, but like what could have been worded better, or what type of information might have been helpful here, so that I could kind of follow that editor's eye and use what I was learning to apply that to future writing projects and opportunities. And so I became a much better writer over time, because I had that person who had that great editorial eye and who I could learn from. But if I didn't have the humility, right, to accept that feedback, to be open to that critique, then I wouldn't have had the opportunity to improve, because I would have rejected all of that, right? So having some of that humility and openness to critique is going to be really important. And I'll say the last characteristic to highlight that will help you know if you can be a good health content writer, particularly on a freelance basis, is having tenacity and being able to push through even when you are not getting the response that you're looking for. Um, Freelancing in general, whether we're talking about health content writing or design or web development or whatever, freelancing in general, in any situation where you are offering your skills or services to another person or organization, you're going to get rejections. People are going to say no. People are not going to respond to you. People are going to have, different types of reactions. Like you are going to face uncomfortable situations as a freelancer, because that's just the nature of the game. But what you have to have in order to find success as a freelance health content writer is the perseverance and the energy to keep pushing and keep moving forward, despite hearing feedback that you might not want to hear all the time, right? Sometimes a company might be interested in working with you, but it's not the right time, or they don't have the budget, or they're already working with someone else, or they just don't want to work with you. All types of reasons. Again, maybe they don't respond to you at all. You have to have that tenacity to follow up, to have the conversations when you aren't really sure whether that person is going to be receptive to your offers for help or your offers for services, right? You have to have that will to keep going even if you're not hearing the response that you're looking for, because if you don't keep going, you'll never get the responses that you're looking for. If you stop, you'll never progress, you'll never move forward. So you have to keep going so that you can get to the good parts. Um, I think I will pause here because I know that was a lot of information in terms of what characteristics and attributes are good to have. But if you have any questions about anything that I talked about here, feel free to leave a comment or ask that question. I should let you know that the May cohort of health professionals to health writers is full, but as always, you can drop the word waitlist in the comments if you would be interested in joining the waitlist. Health professionals to health writers is a 4-month accelerator program that teaches pharmacists and other healthcare providers how to replace a portion of their primary income through freelance health content writing. And so I will look out for any questions or comments in the comments. And otherwise, I will talk to y'all later. Have a good evening.